I'm a urologic oncologist. I'm in the Army. I'm stationed at Walter Reed. I was fortunate enough to do a urologic oncology fellowship here at Indiana University from 2019 to 2021. It was Easter Day. Did a routine exam that night in the shower and felt a lump in my right testicle. It was something called non-seminoma. The reason why I wanted to come here is because I wanted to be treated by my mentors, and I wanted to be treated at a place that I don't work at. Infusion started for bleomycin, etoposide, and cisplatin, BEP, 321-day cycles. Chemo-induced peripheral neuropathy and ototoxicity were the two biggest side effects that I was concerned about, both for my career as a military officer and being able to, do everything that was required of me, but then, also more importantly as a surgeon. And the peripheral neuropathy, namely, would be like numbness and tingling in your fingers or your toes or bottom of your feet. The tips of my fingers are a little sensitive.
Okay.
The first day that I was here with my infusion, Michelle Bailey's flyer for oncology massage was in the infusion treatment area, and I looked at it and I said, hey, let's do this. It couldn't hurt.
Did they say anything about you possibly losing your nails?
Nope.
Or was it's just a sensitivity?
Yeah, it's just underneath the nail.
There are not a lot of oncology trained massage therapists throughout the United States. We need to be aware of and have an understanding of a lot of medical terminology and a lot of medical interventions, what the patient is going through, whether it's radiation oncology, surgical oncology, or chemotherapy oncology, those treatments that the patient is going to be receiving. When I met Sean, I think his biggest concern was his hands and the development or the potential development of the chemotherapy-induced peripheral neuropathy, which we just say CIPN for short. He is a surgeon, and so it was just vitally important that if the onset occurred, that we could keep it at a minimum. And so I came alongside and provided massage therapy, a protocol specifically for CIPN to help reduce the onset. I'm here because of the IU Health Foundation and because they provide the funding for me to be here, and because our patients are not charged at all for any service, whether they're inpatient or outpatient. They do not get billed for massage in any way, shape, or form. She
not only taught me how to do the massage by myself and have my wife teach me how to do it, for her to do it at home, but she gave me a massage ball to work on the massage at home to try to kind of stimulate the nerve endings. And I thought that was helpful, not only mentally knowing I'm doing everything I can to prevent chemo-induced neuropathy in my fingers, but to know, like, psychologically that she's there to just talk with during the infusion, and the massage itself is relaxing, so it helps kind of take my mind off of what I'm going through. I'm really glad that IU has those services here. I'm pretty excited to say that today is the last treatment day of the third cycle. It'd be nice to be done with chemotherapy and then, to get back home and kind of resume life as best as I can. Obviously this experience is going to shape me quite a bit with how I see patients and how I think through the disease and try to be an advocate for the disease. I'm just really thankful to be here and get the care that I've received here. I'm beyond thankful.